Hello everyone, this is Dr. Kim. You're looking at a panoramic radiograph of a 32-year-old patient. I'm going to zoom in and have you take a closer look at this anterior mandible. As you look through the premolar to premolar, try to pay close attention to the root apices and the alveolar process. If there's anything that stands out, just try to keep that in mind before I show a periapical radiograph of this area. I think you'll be surprised to find the differences between the panoramic image and how it appears on periapical radiograph, or in this case we have sort of a occlusal radiograph of the area. Okay. If there's anything again that stands out, make a mental note and I'm going to show you PA of this area. Alright, there you go. So clearly on this radiograph you have like I would call this occlusal radiograph rather than periapical of central incisors, just because how many teeth you can see, and then the angulation of course. But anyway, let's get to the main point, which is this. Clearly there's a well-defined corticated radiolucency on the mesial aspect of number 25, which at about mid-root level, which again was not clearly seen on panoramic radiograph. If for any reason you noted that, I am completely surprised, and I kind of wanted to pick your brain as to what you saw that led you to think there was a radiolucency. Perhaps there's things that I can learn and from you, but I certainly didn't see any obvious sign that there was a radiolucency between the incisors, but here we go, right? Everyone can see this. And at this point, whenever you're looking at a radiolucency or any lesion in general, there are certain things that you have to ask yourself, whether it's round, basically the shape, and its border. You have to determine whether it's well-defined, ill-defined, is it corticated or not, non-corticated, does it scallop around the apices, is it expansile, what's its behavior on adjacent structures. In this case, I think it's hard to argue that there's a root resorption. Maybe I said it the other way. I don't see any evidence of root resorption in this case. And whether there's a displacement or not, does it cause expansion of the buccal cortex or lingual cortex, which we cannot tell definitively based on this radiograph, but those are some of the things you have to ask yourself. And as far as coming up with differential diagnosis, you may want to account for all the things that we've already mentioned, but also the patient's age and gender, and that can be important. Again, the vitality would be important. I don't know, but I would presume that this patient is vital, or these teeth are vital, based on the lack of restoration or obvious history of trauma in this area. So those are the things that can help you to determine a proper diagnosis. I just wanted to show you again the rather drastic difference in its appearance on periapical or occlusal versus the panoramic radiograph. Thank you very much, and I will see you in the next video.